So why is it that the Deep South has higher death rates than, say, California or Nevada? Why is it that some people live longer and stay healthier and others don't? So let's look at a short video presented by Healthy People 2020 related to what we're going to call the determinants of health.
Determinants of Health, a framework for reaching Healthy People 2020 goals. What makes some people healthy and others unhealthy? How can we create a society in which everyone has a chance to live long, healthy lives? These are just a couple of the important questions that Healthy People 2020 explores. The range of personal, social, economic, and environmental factors that influence health status are known as determinants of health. Determinants of health include biological and genetic makeup, individual behavior, social interactions and norms, the physical environment, and access to health services. For example, stress, discrimination, education, housing, and unemployment are all determinants of health. Healthy People 2020 places new emphasis on the social determinants of health, while continuing to address the full range of determinants. Health starts in our homes, schools, and communities. Let's take a closer look at how determinants of health can affect our lives. Meet Carla, a 6-year-old African-American girl. Carla lives in an urban area. She doesn't have any parks or playgrounds close to her apartment building, so she does not get enough daily physical activity. Carla takes the bus to school and back. Her grandmother stays with her after school. Carla typically watches 4 hours of TV a day. Now, picture an intervention that can change Carla's determinants of health. A group of parents work with the school board and the local YMCA to keep the gym at Carla's school open later on weekdays and on days when the school is closed for vacation. This provides community members with a safe space to exercise and play. Now, Carla's grandmother meets her at the gym after school. Carla's physical activity level increases as she spends more time playing with friends at the gym and walking around the track with her grandmother. She is spending her after-school hours at the gym, which means she's also watching less TV. Let's look at another example. Meet James, a 76-year-old Caucasian man. James lives in a low-income neighborhood surrounded by convenience stores and fast food restaurants. James has to take the bus to get to the closest grocery store. Diabetes runs in his family, and James was recently diagnosed with type 2 diabetes. What type of intervention may benefit James? How about a subsidized farmers market within walking distance to James' apartment? The City Health Department and a statewide farmers organization create a local farmers market program in James' community. The program is subsidized by the city, which allows farmers to sell fruits and vegetables at a lower cost. The farmers market program targets high-density, low-income neighborhoods like James. Now, James walks to the farmers market each week, increasing his physical activity level. He's eating more fruits and vegetables now that he can afford them. James is also eating less canned food, higher in sodium. James' new diet and increased physical activity are helping to keep his blood sugar under control. These examples show how determinants of health can impact our lives and how, working together, we can improve the health of individuals and communities.
The determinants of health are the underlying factors that ultimately bring disease, injury, death. In other words, they are the contributory causes. So our author has categorized the determinants in the way that's presented here, and it's easy to remember because it spells big gems. So the determinants are those forces that influence whether or not a person is at greater risk of developing disease or not. So let's take a look at big gems in detail. So, behavior. Behavior is all the actions associated with the development of a disease. So things like smoking, exercise, using condoms, these are all personal behaviors that help reduce risk. Infection. Individuals that are exposed to germs are more likely to develop infectious diseases. So exposure to disease, exposure to germs increases your risk of infection. genetics can play a role in the development and progression of a disease. There is a field of study called epigenetics, and that's looking at how changes in an organism are caused by modifications of gene expression. And that change in gene expression may be caused by an environmental factor. Geography can influence our health. So this has to do with the actual geographical location that we are situated and how location influences the frequency and prevalence and presence of disease. Environment. Environment has actually been now classified 3 different ways. There's our natural environment that can cause disease or illness. Things like standing water will create more mosquitoes because that's where they breed. If I live in an area that has tornadoes or floods, those are caused by the natural or influenced by the natural environment. The altered environment is the natural environment that's been polluted by man. So when we dump toxins into lakes and rivers, when we frack for gas and we use chemicals that are pollutants, that can impact the natural environment. There's also the built environment, and that's the physical environment built for humans to use, things like housing developments. So the built environment is going to look at, is there enough green space for some children to play? Can people exercise? Are there grocery stores nearby where they can get fresh fruits and vegetables? That all has to do with the built environment. Medical care. So does a person have access to medical care? The Patient Protection and Affordable Care Act is supposed to provide access to medical care for everyone. There are other barriers to medical care besides the ability to pay. If you live in a rural area, there might not be a doctor or a nurse practitioner for many miles. So that would also be something that would fall under access to medical care. And then there's socioeconomic cultural determinants of health. And these are things like education, income, occupational status. So if you don't have a job, there's a lot of stress that goes along with that because you can't pay your bills. That impacts a person's health. We also know that education is a huge determinant of a person's health. Income, yes, because if you don't have money, there's again that stress of not knowing where the next meal may be coming from, and that can impact your health. The last concepts I want to talk about are just things that can change in populations over time that can impact health. And the first one is called a demographic transition. So this is a transition that's influenced by falling childhood death rates and extended lifespans. So it's looking at the age distribution across a population. So for example, this is the population pyramid for Nigeria, and you can see that it's pretty constant. So in 2000 you had fewer old people, and that as it went lower in age it was increasing, and so people were born, and then over time it starts to decay and people start to die, and it's pretty constant over all of these years. So now let's look at another country. Let's look at Japan. And here in 2000 you can see that there was a bulge here and there was a bulge here. 5 years later it's anticipated that those bulges of course are going to move up and it's going to look like this. And then 50 years later, the one bulge, all of these individuals will have passed away and you just are relying on this bulge. But the thing is that if you only have a constant birth rate, people tend to die, and so this is what it looks like. In terms of public health, you have to think about what are the needs of people at different ages and how will that impact health. Here is the United States. Now you can see in 2000 we had these are probably the baby boomers. 25 years later there's an increased birth rate because of immigration and an increase in children, and then you can see that now it's ballooned and There's a lot of people under the age of 80. Actually, let's see, even under the age of 65. So that's called a population pyramid. And the question is, how will these changes impact health? And it has to do with resources. What do the people at different ages need? Another change is called an epidemiological transition, and this implies that as social and economic development occurs, different types of diseases become prominent. So, with developing nations, we find that infectious disease is predominantly what kills populations, whereas in developed nations, we find that lifestyle diseases are what are killing the population. So, in say a poor area in Africa where they don't have sanitation, you'll find infectious diseases impacting the population and being a burden of disease. Here in the United States, it's not so much infectious disease as it is lifestyle diseases such as heart disease and diabetes. So this is called an epidemiological transition. We're finding this in certain cities in China, which is still considered a developing nation, but those industrialized cities are finding increased death rates with lifestyle diseases as opposed to infectious diseases, whereas the poorer areas, it's still infectious diseases. And lastly, a nutritional transition. So this implies changes in available food may impact a population's health. So you could have a country that moves from a poorly balanced diet to one that has greater nutrition, or if you look at our country, a lot of times we might say, well, we used to have really good food when people were eating from farms, but now with all the processed foods that have fat, sugar, and salt in them, we're finding that we have more disease.